Afternoon, everyone, to this European Patients Forum webinar on artificial intelligence as part of our ongoing webinar series. My name is Kaisa Immonen. I'm the Director of Policy at EPF in Brussels, and I very much welcome you today. We will have 1 hour for a very interesting discussion on the potential implications of use of artificial intelligence on patients and healthcare professionals. I think we can start. If we have already, we may get more people entering, maybe.
I think we can start. I will keep on accepting people as soon as they join.
Let's start now so we have enough time to go through everything and people will come in as they come in. So today what we will do is first I will say a few words about EPF's work on AI to put this webinar in context. I won't take too long about it. And then I will introduce our 2 wonderful speakers from whom you will hear today. And I would just like to make a couple of housekeeping points. First is that this webinar will be recorded and it will be available online later for watching. So if you are not comfortable with being recorded, you can leave now. The second thing is that if you speak, or if you want to ask a question, you can put it in the chat. You can also, I believe, raise your virtual hand. And I would advise that whenever people are not speaking, so most of the time, please keep your mics muted so that we avoid background noises. We will do the presentations first and then we will have a discussion after the presentation. So if you have questions and comments that come into your mind, please note them and then we will take them during the discussion. I hope we can address all questions. So can I have maybe the first slide then of my introduction, please? Okay, maybe yes, so just in case there are people in the room who are not familiar with EPF, we are a cross-disease patient organization working at European level. So we don't work in any particular condition, certainly not in any particular product. Our mission is to drive the patient voice in EU health policy and activities generally. Next, please. This is a definition of artificial intelligence for those, and I have to apologize for those who have attended previous webinars and may have seen this same presentation. So you will see it again briefly. But just to set the scene, what are we talking about when we are talking about artificial intelligence? Essentially a simulation of human intelligence processes by machines. This definition is from the European Commission. It's not the only one that exists. There are also others. But I think the thing to note here is that AI-based systems can be everywhere, and they can be software such as voice assistants, or they can be embedded in things, hardware devices like robots, cars, drones, etc. Next, please. Why is all this important for patients? Well, because increasingly the development of AI-enabled tools in healthcare will be becoming more common, and this will have impact on patients. So, and I'm sure our speakers will touch on these aspects, so I won't say too much about it, but obviously there are many promises in these technologies for diagnosis, for clinical decision-making, treating patients better and more efficiently, but also potentially challenges, unfulfilled expectations from patients, or impacts we cannot foresee. So what we want to do as EPF is to provide a patient perspective to the discussions that are going on at European level, but also national level eventually. And our patient community needs the capacity to engage in these discussions, which can be highly technical. Next, please. So last year, we started this capacity building initiative specifically on artificial intelligence. And it consists of a series of webinars, which has been ongoing this year. We started earlier this year with the basics, and we covered several topics. All of them are and will be available online in the AI Knowledge Hub, and they can be watched afterwards there. We will also be launching 2 reports shortly of research that we commissioned. One is on the policy and legislative framework on AI in Europe, and the other is AI from a patient perspective. And we have in EPF, of course, a digital health working group, and we will be engaging with that working group and interested members on shaping a policy statement and recommendations in the next year. So stay tuned and get involved if you're interested in this topic. Next, please. So just, you know, I've already said this today, I believe, so I don't have to repeat it, but yeah, just to point out that we do have time. We will have about half an hour for discussions, and we'll try to take all questions, but if we cannot take them all, then feel free to reach out to us afterwards in writing if you have specific questions that you feel you didn't get answers to. Next, please. So this was my introduction. And without further ado, I will hand the floor over to our first speaker. We have 2 excellent speakers today. The first of them is Toni Andreu. He comes from the European Infrastructure for Translational Medicine, which is known as EATRIS, where he is scientific director. So he coordinates the scientific and technological activities there. He has also been the director of the funding branch of the Spanish National Institute of Health and the director of the Spanish National Institute of Health, and also a CEO of the Bellvitge University Hospital in Spain. So he knows that environment as well. He's been helping create the General Directorate for Research and Innovation in the Catalan Ministry of Health and has a PhD in medicine from Barcelona. Toni, we're very happy and excited to have you with us today. I would like to hand the floor over to you, please.
Thank you so much, Kaisa. Thank you to EPF for inviting me. I'm very happy to be with this community today for brainstorming a little bit the current moment and the development of AI solutions in the healthcare domain. I'm going to share my screen. So let's see if someone can please confirm that you can see it.
We can see it.
Perfect, terrific. Okay, so over the last few years, there has been an enormous development of AI in all different areas of the societal fabric, but also specifically in the healthcare domain. And now AI is not a promise, it's a reality in different areas of the value chain for providing healthcare services to the community, from the area of diagnosis and, as you know, for instance, digital pathology, particularly when works in conjunction to a real human being, has increased about the accuracy and the precision of diagnosis in the area of pathology. Medical image is one of the great examples, but also other areas of the translational value chain in the medical care have been positively impacted by the use of AI. For instance, the process of drug discovery, and now drug developers, they use routinely AI for identifying molecules that can be transformed into novel drugs, into novel solutions for unmet medical needs. And other areas of the healthcare delivery have also been strongly modified by the power of AI, such medical robots, of course, the dissemination and implementation of electronic health records, and also the way we develop clinical trials. We just had altogether a very significant example of the impact of AI, because during the recent COVID-19 pandemic, most of the predictions that were done by the healthcare authorities at the societal level were using AI solutions for identifying the development of the outbreak all over the world. So AI is definitely here. And this image that illustrates the variety of the use of AI in the medical imaging process would have been completely impossible 15 years ago. And now AI algorithms are providing a specific power for increasing the accuracy in the process of medical diagnosis. This year, 2022, has been a particularly significant year for the development of AI in the healthcare domain and all over the societal fabric. And I strongly recommend these 4 documents that for me represent kind of key milestone in the development of AI towards the future. All of them, they have been published in 2022. And the first one is a very interesting report that was prepared by the European Parliament to focus on the specific challenges and opportunities for applying AI solutions in the healthcare domain, with a specific focus on healthcare. AI is being until now regulated based on two processes that were set in 2017, the Medical Devices Regulation and the In Vitro Medical Devices Regulation. But at those days, AI was at the initial stages. We didn't have much experience on the process of implementing AI solutions that push us to the development of more precise regulatory framework for AI. And as you know, the European Commission published a proposal for creating a new regulatory framework for AI earlier this year, that tackles the challenges for the development of AI at all different societal levels, including healthcare. And of course, this has opened a very interesting and highly relevant debate on the ethical legal aspects of the AI when it's applied to specific societal activities. Well, now that more and more we are acquiring experience in the use of AI, we are also identifying the potential risks. And we know that non-proper use of AI solutions can have a negative effect and can lead to patient harm or misuse of the tools that have been developed by the AI developers. And there are also more systemic risks in the implementation of AI in the healthcare domain, such as, for instance, the risk of bias in medical AI approaches perpetuating health inequities. Of course, the risk of lack of transparency of this solution, privacy and security issues related to the specific use of these tools, and gaps in the accountability process, and of course, obstacles in the implementation in the real world of healthcare, considering that it's a new tool for which most of the systems are not properly prepared. I want to point maybe a couple of relevant risks that we have to take into consideration. As you know, an AI solution basically is a computational decision process that is trained with the use of of data that is existing and has the capacity of training this algorithm, training this kind of solution. But then the solution is going to apply on one specific group of patients or individuals that could be potentially very different from the data sets that have been used for training these solutions. Therefore, it is important that we have to be very careful about the risk of creating a data shift between the data that has been used for training an algorithm with the reality of the real world data when that particular algorithm is going to be used, and proper use of this difference can lead to misdiagnosis and of course to false diagnosis as well. In that sense, it's very important that AI developers and healthcare providers, when accepting or incorporating an AI solution, they must perform always a comprehensive multi-center evaluation to identify these instabilities in the data sets that have been used for training the algorithm and for implementing the algorithm in the real world data. And that has a secondary consequence, which is absolutely essential, something that I'm pretty sure Ildikó is going to talk about it later, which is the fact that these solutions have to include all the stakeholders that participate in the process, mostly clinicians, healthcare providers, and patients themselves. Without the proper, let's say, engagement of these communities, there is a real risk that the solution that we are going to develop won't have the effect for which it was built. But of course, even if a tool is robust, it's still going to be used by human beings. And in that case, there is the risk of misuse. And considering that we are dealing with a group of tools for which we have little or no experience at all, it is important that we develop a framework, a system where there is a proper engagement and a proper involvement and citizens and clinicians in the process of developing these tools, with proper training programs, increasing the awareness and the literacy among patients and the general public in general, because at the end of the day, we have been developing, let's say, up to a certain extent, a disruptive tool that is changing the mindset of the society in the way we interpret healthcare is going to be delivered. So we need to make sure that these tools that we are developing are going to be properly embraced by the general public to guarantee an efficient and transparent use. And there is a risk here at this moment where there is a multiplicity of different solutions that have been developed with no supervision and no regulation. And we all have experience of mobile AI solutions that are able to measure some determinants of your health that have not been submitted to any process of accountability or validation. There are also some systemic risks that we have to take into consideration, because the use of these tools have to guarantee that we are not going to perpetuate already existing inequities in the way we deliver healthcare solutions, and therefore represent the data sets that are going to be used for creating these algorithms have to guarantee diversity and inclusion of all the different population groups, ethnic groups, gender, different socioeconomic levels, and so on. Of course, geographical differences and so on. In that sense, one of the risks that we have is a lack of transparency on these obscure computational-based tools that we need to understand. And in that sense, it has been proposed the creation of an AI passport for documenting the entire value chain of a particular AI solution, where we will include the concepts of traceability and explainability as prerequisites for providing a public certification for the use of that particular solution. Understanding traceability as the transparency in the process of developing the algorithm, and explainability as transparency in the AI diagnostic themselves. Privacy and security issues, and we need to develop specific regulations that should be able to address the accountability process for the development of these tools in a particular moment where, as I mentioned later, we are going to develop federated approaches where the data sets that are going to develop these solutions are going to stay in the places where the data is generated to avoid unsafe transfer of data. And of course, it requires a strong process for accountability and making sure that the obstacles, cultural obstacles that already exist in healthcare institutions are not going to represent a barrier for the implementation of these tools. In that sense, this is what the European regulation for AI wants to tackle. As you know, there is a level that tries to stratify the level of risk of a particular AI solution. And most of the AI solutions that we are going to use in the healthcare domain are classified in the area of high risk, which means basically that when a developer is developing an AI tool, this tool needs to undergo a conformity assessment to make sure that there is a robust process that follows the guideline principles that are included in the regulation. And one critical element of this proposal regulatory workflow is that if in the process of implementation there are substantial changes by which this tool is being modified, the tool needs to go back to the initial stages and needs to undergo again to the conformity assessment to make sure that it's full compliance with the AI requirements. Of course, there is a strong ethical debate behind all this, let's say, fierce discussion. And there is one clear element among all the different ethical elements that feed this debate, which is the concept of oversight the development of tools. AI tools should not be autonomous tools in the healthcare domain, but should be interpreted as an assistive tool for the human decision. And this is something that we need to agree, we need to understand as something that is going to sustain the ethical principles by which we are going to develop and we are going to improve our healthcare model in the future. There are, of course, challenges at the technical level. One of them is the quality of the data that is already existing in the data sets. This is something that we have to work, because this process of digitalizing the data that is going to use for creating the algorithm, we need to put a special effort, healthcare providers, data generators, making sure that this data has reached that precise level of quality that are required for the development of these algorithms. And in this context, one of the things that becomes more and more evident is that we are not going to create in Europe or in specific countries or region kind of a data set that is going to include all the data that are in that particular context, but data sets are going to be federated, and the data is going to stay in the place where the data exists, to make sure that we are not going to go under unsafe process of transferring data. And for that, we need to build data standards, tools for data interoperability, and follow the principles of verification, which is something that I'm pretty sure you have been discussing in previous seminars.
Toni, may I ask you to try to wrap up in the 5 minutes?
I will do it in probably 2 minutes, yes.
Wonderful.
Just one specific and important element is that in the patient journey, AI is going to be along the entire process, from prevention interventions, screening, diagnosis, staging a particular disease, and treatment. This is something that affects the clinical decision process at all the different levels of the value chain. And Europe has reached, as you know, a very important initiative, which is the development of a European health data space that wants to develop the right tools for assuring data standards and data interoperability to make this possible. At the end of the day, what we want to make sure is that these tools that we are going to develop, they are going to develop on a culture of trustworthiness, and is going to be understood and accepted by the society, by the professionals, by the patient, as a positive element that is going to improve our healthcare system. So this is what I wanted to share with you, and I'll be more than happy to answer your questions at the end of the next presentation. Thank you, Kaisa.
Thank you, Toni, for this very clear overview. And I really like how you put it in context also of the risks and benefits of new technologies. I'm sure there will be questions for you. But before we go there, I'd like to go to the next speaker, because we have 2 presentations. So the second speaker is going to speak from a patient perspective. Her name is Ildikó Vajda, and she's the Senior Policy Officer in Digital Health at the Netherlands Patiëntenfederatie, which is an EPF member organization. And she has also been policy advisor on innovation at the Association of Collaborative Top Clinical Hospitals, co-chair of the Dutch PROM platform. I assume PROM means here patient-reported outcomes measurement. And she's also involved with the Patient Dome for Rare Disease, Rare and Genetic Disorders, VSOP, and EURODIS, where she's a policy advisor. So Ildikó has also a PhD in neurobiology and a master's in biology. So she is another very expert speaker who will now tell us about what patients should think about AI. Ildikó, the floor is yours.
Thank you, Kaisa. Welcome, everyone. I'm happy to be here, and thank you for the invitation. I will try to share my slides. Let me see whether it's working. Share screen. Is it working?
We can see it, but it's not yet the full screen.
It's not yet the full screen.
I think you need to click on the slideshow button and then it will be.
That is a good idea. Let me see, where does it?
We can see it is just a bit small.
Yeah, it's just a little small.
If you could help me with where I do find the button.
You go to weergaven instellingen and then you choose the presentation mode.
Yeah, I did that, but it's another. Let me see.
If you want, we can share the slides.
Yeah, that maybe. Well, no. Let me try this way.
No pressure. Yes.
So
Okay.
fine. Just F5.
Okay. So my name is Ildikó, and I will talk about our experiences as the umbrella organization of almost all patient organizations in the Netherlands on AIs and its effects on patient and professional relationship. So for those of you who don't know who we are the umbrella organization, and we have 53 members, many of them midway umbrella organizations, meaning that they are also having their members. So in total, we have kind of 200 organizations. And we are actually the voice of the patient in politics, but also we do a lot of projects aimed at consultation room issues like shared decision making. And we also represent the patient's voices, in the news, in the health insurance sector, etc. So we are about 75 people in our organizations, and digital health is one of the biggest pillars and topics. And we are quite active on this topic with a few of our members, I must say, because this topic is still new, and organizations still need more knowledge about AI. So what we are doing is actually, we are doing some research on what AI actually means for the patient professional relationships. We are getting insights and the needs of patients. Then based, among others, on these researches, but also on dialogue sessions that we perform with patients and citizens, we have written a position paper on AI in which we present our conditions that I will talk about later. And we are also performing so-called guidance ethic workshops in which we are looking at the best way and actions that actually are needed to put this technology and to guide this technology properly into the consulting room and into the hospitals. So for now, I chose actually 2 activities to highlight for you. And at the end, I will also mention just the key takeaways of our position paper. So I will talk about a little bit about the research we have done and about the dialogue sessions. As Kaisa and also Toni has mentioned, AI has a great potential. Here, this scheme is from our position paper, and we don't call it the patient journey, we call it the healthcare continuum, but in fact, it's the same. And for us, it begins actually at the secondary prevention, when people are already having some higher risk, and going through diagnosis, treatment, if needed, rehabilitation, monitoring if you have a chronic disease, up to palliation. And we try to pinpoint possible benefits of AI at each of this stage, that I will not read now, but you can take a look afterwards. And actually, every stage may benefit from this new technology. And in fact, every stage consists or has some form of patient professional relationship, perhaps secondary prevention, not all the time, but the rest does. For our research, qualitative research, we have focused on the treatment phase, where AI could have benefits like more effective treatment, choosing a more effective treatment, less complications or side effects. So this research consisted of desk research and depth interviews with, I guess, 16 or 17 healthcare professionals, AI experts. And we were asking them about, about their opinion and their expectations. And our focus had two topics. Actually, we were focusing on shared decision making and the digital decision aids or tools that are being used in this process. And our questions were, what are the differences actually between these enriched decision aids with AI enriched and the classical decision aids for the shared decision making? And what are the consequences of these enriched decision tools? So before I jump to the main conclusions, I would like to take you in the field of shared decision making, which is actually a process. It begins with the choice talk, and actually the choice and the options talk together with the professional is mostly happening at the same time during the same consult. And then, depending, of course, on the disease and on the decision to make, which is which treatment should I decide to follow, or should I decide to follow a treatment at all? The patient goes home and takes information that she or he gets. And actually, for this period that the patient is getting information, there are already decision tools. These are also called option grids, which are actually paper-based version of it. But nowadays, at least in the Netherlands, there are also digital tools, which are actually an interactive stepwise process that the patient is going through. I have put here at the right corner a link that you can take a look at several of these decision tools. So the patient is led step by step through relevant information about the disease, which treatments are available, what are the pros and the cons of each treatment, and very importantly, at the end, the patient's preferences is also inventorized and put next to the treatment options, which also includes doing nothing if you don't want to get treated. So this is just a screenshot to give you a feeling of what is important to you, the preferences, how it looks like. So the patient is actually sliding in this slider, for, in this case, for a carpal tunnel syndrome. And depending of the preferences, the slide bar are pushed. And at the end, there is a whole list of preferences, which is at the end put in a matrix for each treatment option. So the difference between this interactive online digital decision tool and that with the AI is right now not obvious for the patients. Some of these tools already has some AI calculations beneath, but it's still in development and actually only in a trial version, so not really in the consulting room yet. So I just put here the information that these decision tools are actually being used during this decision support phase. And after that, of course, the patient goes and has the decision talk with the professional and brings on an iPad or laptop or whatever, or printed, this matrix that she or he has produced by the decision tool, together with the decision tool. So the first question we have asked are, what are actually the differences between classical decision tools and those enriched with AI? And actually what we have seen is that considering the kind of outputs, there are not big differences, but both actually can express probabilities as positive chances or negative risks, or think of the chance for recovery or survival, or a chance of estimating how many healthy years you may live. And negative risk, you may think of course, the risk of passing away, risk of complications or hospital reuptake, and so on. The difference is that for the classical decision aids, this risk information is mostly presented in a way that has to do with the group to which you belong. So these are group specific and mostly also time specific information. To give you an example, people like you, middle-aged, between 45, 55, with this BMI has a risk of 15% to develop comorbidity within 10 years. This would be the information you get. The information you get from the enriched tool with AI is a number, actually. This is and this makes things a bit more complicated. How do these tools work? Well, the classical tools use aggregated data, which are from clinical trials, mostly randomized clinical trials, systematic reviews, meta-analysis, etc. So, and these are in clinical guidelines, and they are presented. So there are groups of patients, and then you belong to one group, and then there is a further detail on what treatment is the best for you based on medical evidence, of course. For the AI, of course, is this not the case. So this is not a knowledge-based system, but purely based on associations, not even causality, in large data sets. The explanation of the information to the patient is very important. It's crucial. And what we have found is that in classical tools, the sample pictograms you probably are familiar with are presented here in red. How many people has developed a problem from the 172% of the people developed. For the modern AI enriched tools, however, is this not the complete story, and we are still looking, or at least the experts are still looking, how to visualize and how to explain it. And this is just one example of what I've at least found that puts your mind in the way that perhaps we should think of explanation, if it is possible. Here in the top of the picture, you see this viaduct, and an explanation is right next to it. And then you see on which parts of the visual image, which parts contributed most for the recognition of this viaduct. If the model is not explainable, so the black box, which is quite literally depicted here as a black box model, then of course there is no explanation possible. However, if the model is explainable, and then at the very, very right bottom, you see perhaps is a way to explain what kind of data, which data type has contributed to which extent to the prediction. But I will jump to the conclusion. So the possible consequences was another research question. And from the interviews and desk research, this is what we have concluded, namely that the information that the AI is giving to you could be misinterpreted. It could be because of misinterpretation. It could also be wrongly explained, or even if it is perfect and okay and without bias and without whatever, it's just difficult to comprehend by patients. So this informed consent and this informed process during shared decision making is under threat, actually. There is also the possibility that what the AI is saying contradicts what the expert, the professional is saying. These are difficult ethical issues. So this might lead to treatment decision which is frozen. Nobody knows what to choose, actually, or the decision is postponed, or the decision is wrong. And of course, what Toni has already said, this can have even fatal consequences. The other is that the consequences could be context related. So for the patient, it might be unclear what exactly the role is of this algorithm. Is it a second opinion? Is it a team member of the professional? What is it doing actually? When is it consulted? This also implies that the responsibility are, in these cases at least, unclear. Who is responsible if something goes wrong? And it's also interesting that the professionals' attitudes towards AI and trust in AI differ. Some of them are trusting it too much, some are trusting it too little. So that could also lead to confusion, even fear, and the same risks and consequences. The other things, I don't know how much time I have, I will go quickly, is that we
can go in a couple of minutes, that would be great.
We are conducting also dialogue sessions with patients and citizens. This is a photo when we are talking about a use case. We have already had 6 dialogues, about 6 use cases, from, breast cancer, prognostic AI tool, image recognition for lung cancer, a lot of things. And we are then having an open-minded discussion and are trying to answer tools, or actually to gather information about the attitudes of the people. So we will try to answer questions like where in the process is the AI tool to be used, how autonomous it should be, which is very interesting because Toni just said it shouldn't be autonomous. Maybe we during the discussion, maybe we can come back to it, because some people think in a certain context with a certain conditions, it should be. When should patients be informed that AI is used? Do they have the right to refuse AI? These kind of questions. So, and actually, because the differences in the AI tools and the underlying AI technology, black box kind of things, it's just the conclusion that there is no one size fits all answer or solution. So we need best practices. And this is my last slide. So these best practices we need. And also we have put it into our position, that this is new position paper. It comes down to trust, actually, trust and knowledge about AI. So what needs to happen? We also think that without patients' participation, these tools will be too much technology driven and too little driven by the need of the patient. So it's really needed, and also for the ethical aspects. So we need best practices. We need successfully embedded AI tools in the healthcare process. We would also like to start or to establish a healthcare algorithms knowledge bank as a database, also for transparency reasons, but also to share knowledge for similar AI tools. So how is it developed? What are the tricks and the tips? What kind of bottlenecks has been identified? So not to make the same mistake. To get into this knowledge base, we need some criteria, a kind of review framework, which we would like to put in place. And at last, but very important for us, that each and every AI application, which is embedded and validated and it is ethical and legal and trustful, everything Toni was talking about, that it is also provided with explanation in plain, understandable language for the patients in the consulting room, in the hospitals, at the GP. Why is it used? What is the function of it? What is the role? And in this way, to be able to be informed and to maybe even to refuse if it is not proper. I think that was it. Yeah, I will try to.
Thank you, Ildikó. That was a wonderful presentation. Thank you so much. And a lot of food for thought. I think what you're doing in the Netherlands is really interesting work, and thank you for sharing it. Now we have a little bit less time for questions than we hoped, but we can take some. So if you have a question, please either write it in the chat or actually, I don't know if you can raise your hand. Maybe you can just also take the floor, but please introduce yourself, switch on your camera and say who you are if you want to ask a question or comment. And while people are thinking about it, may I ask Ildikó if your work from the Netherlands is available in English or is it only in Dutch?
The position paper is almost available in English. I just need someone to, some last editing step, and then I can share it with you and with the others.
Thank you. I don't see any questions still. So I was actually wondering about this question of liability and who's actually responsible if something does go wrong when using an AI-enabled tool, especially when with self-learning systems you have the possibility that it may become increasingly untransparent or unexplainable what happens in the process. Would either of you want to comment on that, Toni, Ildikó?
Well, I think this is, of course, this is something that is a debate that just opened. Actually, the European Commission, as you know, just published the Liability Act that is trying to, let's say, to solve some of the questions in very specific spaces of the liability process. But of course, this is something that as the regulation develops, we will need to be absolutely clear, because what is happening is that these tools are still being developed significantly by computational scientists that completely are part of the healthcare process, right? Yeah. And most, let's say, dramatic example is the mobile solutions that are giving you clinical answers theoretically to burning healthcare-related questions, and is being developed by someone which is completely apart from that, and sometimes someone that cannot be not even identifiable. So this is definitely a debate that is going to be, for me, the core of the debate, because we need to establish a clear system for liability. Otherwise, we will fail in the regulatory process.
I can imagine that healthcare professionals or organizations might also be reluctant to use these tools if they are not sure, who will be liable. Oh, sorry, Ildikó, please.
Yes. I think that is, at least that is the case in the Netherlands. There are some hospitals that are really pioneering and using medical image radiology devices to recognize at early stage lung cancer or breast cancer, etc. But other ones are still afraid. And this leads me also to the question I wanted to ask Toni. I don't know whether I may, about using it as an autonomous system. The case is as follows. A lot of radiologists here in the Netherlands are overwhelmed by work, and care is really now at danger of not being accessible. So in the field of radiology, there are some voices to make these kind of algorithms fully autonomous at the first stage. So what the logic is as follows. If a breast cancer or lung cancer screening is going on, you have three categories, like absolutely healthy, absolutely cancerous, and the category in between. So people are saying, for these two extreme categories, why don't we put the system in an autonomous way? Why won't? And then if the result comes into the middle category, then you go, of course, to your. So what are your thoughts about?
Well, I think that over the last few years, there's been emerging evidence that the most perfect algorithm, when it's used in the real world, depending on the specific situation where the algorithm works, things may change dramatically. Because we have still not developed a process of accountability of the implementation process of the algorithm. So in this process, at some point, the user, the clinician, can decide to give a certain level of autonomy to the algorithm. But this is always to be a decision of the user of the tool. And by principle, I don't think we should leave full autonomy from the beginning. It's always the human being, the one that will have to decide up to which level we give them a certain level of autonomy based on the experience of the implementation.
Yes, thank you. This is also how we think about it. So I'm very curious how this development will go on.
Indeed.
Thank you.
Yes.
I think the next couple of years are going to be absolutely critical, because this is going to be the time where we are going to test if all these solutions that we have developed over the last particularly 5 years, when they confront with the real world, we are going to be able to establish an efficient process for monitoring them and provide the right accountability for the implementation process. And you said something, Ildikó, that I think is very, very interesting about the role of the clinicians that have difficulties in understanding the use of algorithms or AI solutions in general. This is why it's so important to have all the stakeholders involved in a co-creation process from the very beginning, including the patient community. Otherwise, this concept that you mentioned, that for me is the critical one about the trustworthiness of the tool, we won't be fully developed.
I think that's a point I want to pick up on, actually, because it occurred to me as well as Ildikó and you were speaking, Toni, because everyone talks about the importance of involving patients, but in reality, when it comes to really concretely getting a say in what happens, especially I would imagine nationally in healthcare policies and implementing new technologies, it's not at all a given. Do you think there is a recognition, particularly talking about the sector of technology here, which is perhaps makes it even more complicated? Do you think in concrete terms we are seeing greater involvement, or is this something that we really have to push hard?
Yeah, I think we have to push it. In my experience, patients are forgotten, patient representatives. And I always, when I talk to data scientists or healthcare professionals, policymakers, they are not even aware of the difference between individual patients, you meet at the street, and patient representatives. And then I always have to explain these are representatives who have the skills, who are trained, who know how to participate meaningfully. This is a difference, and and they also know how to represent all their fellow patients, if you want. So these people should be trained, and just like with clinical trials and how to participate, this EATRIS kind of capacity building and trainings. But we have to push much more, I think. It's not happening. It's not happening by default.
Yeah. And I personally think that the way to push this also should be to provide examples of success when there is a real and meaningful engagement of patients with other stakeholders in the development of one solution. Because I think that over the last maybe 3-4 years, we have the debate of patient engagement in the research process or in the healthcare delivery process has been very active. But there is a real risk that this is transforming to ticking the box of having the patient. So this element of providing real examples of meaningful engagement, I think is going to be something that is going to change the mindset of all the stakeholders, involved.
Indeed, but in the Netherlands, project groups are saying, well, if we involve patients, they don't understand what we are talking about. It takes time, it takes money. Let's keep it low level. And then I always say, you don't have to involve patients always at the same highest level of the participation ladder, like informing, advising, consulting, and, co-creating. Perhaps for a few stages of the process in the life cycle of the AI tool where, I don't know, these models are made, patients just should be informed. And at that other stage where, for example, the labels of the AI tools are pros, so patient-reported outcomes, then they should be, of course, co-creating. So I think this layered way of thinking and this more nuanced way of thinking is needed to make it work.
If I can share a little anecdote, because I think it's highly relevant in this dialogue of involving patients in the research process. One of the things that we immediately saw is that something that from the research side was very positively perceived, but researchers just didn't know how to do it.
Yes.
And we are working with them for developing, for instance, a patient engagement toolkit for researchers to teach researchers how to engage patients in a meaningful way. I mean, this is what we are trying to do, is changing the culture of how healthcare is delivered. So it's kind of an exciting time too.
Yes, Toni, that rings a very, very old bell in my brain from 2009 when we did the Value Plus project in EPF on patient involvement. But still, it means we have a ways to go. I haven't seen any questions coming. No one has taken the floor. We are at past, so I don't want to take our speakers' time any more than we have to. So, I mean, would you have any final words to the audience that you would want to share before we close?
Well, perhaps the message, don't be afraid of this technology, because, the logic, the rationale is not that difficult. The deep technical issues we don't have to know as patient representatives, because there are other experts who read. And be open and read about it, follow it, and engage. That would be my message.
Great.
Yeah, and maybe my message is that healthcare delivery is a process where it's a journey that we all share. Patients, clinicians, researchers, policymakers, healthcare providers. We have to feel that we are part of the same journey. And that means that we have to sit around the same table and keep an open and constant dialogue about our expectations and our concern. That will be the way to progress the way we deliver medical interventions in the future.
Absolutely. Partnership and not forgetting the patient. I think this is where we have to close. Thank you so much to both of you speakers. You have been wonderful and shared so much interesting food for thought today. Thank you to the audience, and please do click on the EPF website and the AI Resource Hub. You will have all the webinars there, as well as the soon-to-be published reports and other resources on artificial intelligence. And do engage with us if you're interested in working with us in the next year and beyond on this super important emerging topic. So thank you very much all. Have a lovely evening and see you soon.